What I do in my office all day long, obviously with women newly diagnosed with breast cancer, is walk them through this process and help them answer this one question: lumpectomy or mastectomy. And for most women diagnosed with breast cancer, the surgeon is the first, and surgery is the first line of treatment. And so this is the first decision-making juncture in the decision-making tree. And absolutely, there are things, medical parts of this equation, that make me as the doctor recommend one over the other, but most women really do have the choice. And so much of our work with our patients is collaborating on this decision-making, which is really one of the most enriching and fulfilling parts of what we do, which is working with our patients in a collaborative way to decide what the best treatment is for them. The single most important piece of data that women need to make their decision is the answer to this question, which is, for women who are eligible for both lumpectomy and mastectomy, there's absolutely no difference in long-term survival. And exactly what Perry said, it's so counterintuitive that doing more extensive surgery wouldn't lead to higher survival, but it's absolutely not true. When, God forbid, breast cancer comes back, which thankfully it does not in most cases, breast cancer usually spreads to the body and organs in the body. It does not usually return in the other breast, and certainly not in the other breast. So removing more healthy breast tissue besides the area of the cancer really doesn't provide any benefit in terms of breast cancer survival. Now, absolutely there are cases where we recommend one over the other. And many of you know some of these cases. There are plenty of people, for example, who have the BRCA mutation and are genetically predisposed. And if you perform a lumpectomy on that person's at extremely high risk for having a second event and even a third. And those are people where we very much preferentially recommend mastectomy, bilateral mastectomy. There's absolutely cases where we try to do a lumpectomy and can't get clear margins and get all of the cancer out. And that's a situation where medically it is beneficial to do a mastectomy, and many women choose to remove their other breasts. But for women who have the choice, the survival rate is equal. And that's the key fact in decision making and the key starting point.